Alrighty, welcome back. So I'm going to start with this zoomed in view of the brachial plexus because in your list you'll see for the brachial plexus it also says in parentheses also need to know the trunks and the cords. So I wanted to identify those in this diagram before we move on to the whole arm picture. So we have our nerve roots of the brachial plexus, right? So C5, 6, 7, 8, and T1. So those are the anterior or the ventral rami or anterior rami, either one. And then we have trunks. So we have three trunks. We have superior trunk, middle trunk, and inferior trunk. So it's just the plexus identifying marks. So they kind of have those highlighted in green in this diagram. And then we go into divisions, which we're not having you learn. But then we have the cords. So we have, again, directional cords, lateral, posterior, and medial cords coming off of the divisions. So lateral cord is going to be right here, posterior cord is right here, and medial cord is right here. So however you need to remember it, I know these are lateral, posterior, and medial, but they do kind of look like they go in a top to bottom order. So if you want to remember them that way, that's fine. You'll be seeing them in this kind of diagram. I'm not going to say it's exactly going to be this diagram, but your trunks, superior, middle, and inferior, and your cords, lateral, posterior, and medial. All right, so I'm going to then shift over to this page. And then we can identify the actual nerves coming off of this plexus. We just looked at the zoomed in view here. So we can take a look at these other nerves. The axillary isn't shown on this diagram. We saw it on the other larger picture. And it's just a little root. You can see that on the brachial plexus picture we just left. I won't draw on it because I moved my plastic piece. But here's your axillary nerve. It's just this little root that's coming off of that posterior cord. And the axillary nerve innervates the deltoid and teres minor. Okay, so there's the information for the axillary nerve. Okay, so then we can take a look at the median nerve, just going on in the order of the list. So the median nerve, right, is this one that kind of runs down the middle of your arm. And then it splits. We'll just kind of track it to where it splits. So that's our median nerve. So the median nerve is a pretty busy nerve. So it innervates the flexor muscles of the forearm and the sensory information from the skin over the anterolateral surface of the hand. So if we come down here and look at this diagram right here, things that are highlighted yellow on the picture of the hand, those are the sensory regions that's going to be picked up by the median nerve, just the yellow, right? So we have a good chunk, like the lateral half of the anterior side, and then just some distal parts of your digits 1, 2, and 3 on the posterior side. We can see that a little bit of digit 4. So median nerve, flexor muscles of the forearm, which would be like your flexor carpi radialis and palmaris longus. That wasn't on our muscle list last term. Pronator quadratus, pronator teres, your digital flexors. So when you are describing these things or when you are learning about these things, if you say flexor muscles of the forearm, I'm going to be okay with that because my understanding is you've done your muscle list. I'm not asking you to memorize muscles again. So I'm okay with you doing some consolidating of some of these names so you don't have to list every single muscle if they're all under the category of flexor muscles of the forearm. That's totally fine. And then sensory information from the skin, anterolateral surfaces, right? Kind of thumb side. That's your median nerve. The next one on our list is our musculocutaneous here. So that one sits just lateral to that median nerve, runs right along the humerus. Okay, and then it splits, so we'll stop right there where its split is. Zoom in a little bit. There we go. So the musculocutaneous, again, is another kind of busy muscle, busy nerve. It's got a lot of stuff. And that name kind of tells you that it should be sending information to muscles and also receiving information from skin. That's the cutaneous part. So it innervates the flexor muscles of the arm, right? The median was flexor muscles of the forearm. Musculocutaneous is flexor muscles of the arm, like your biceps brachii, brachialis, and coracobrachialis. And it also brings in sensory information from skin over the lateral surface of the forearm through the lateral, and a branch, this lateral antebrachial cutaneous nerve. That is not on our list. So you can kind of truncate that to the lateral surface of the forearm from one of those little branches that it has here. All right, then we have the ulnar nerve. Okay, so the ulnar nerve is going to be tracking, it's quite a long one, all the way down your arm, down to your forearm, all the way down here to about your wrist. So it runs the entire length of your arm. So again, this is a pretty busy nerve. It's got a lot of stuff to do. It innervates the flexor carpi ulnaris, flexor digitorum profundus, adductor pollicis, and the small digital muscles of the fingers, ones that we didn't really learn the names of. So again, flexor muscles of the forearm, that's a good consolidation of those muscle names. Sensory information from the skin over the medial surface of the hand. So here's our ulnar nerve. That's going to be the pink. Oops, get the hand back in the picture there. So the pinky side of your hand innervation. So this is the ulnar nerve. If you'll notice, it kind of runs right there in between the humerus and the ulna. And that's kind of where your funny bone is. When you whack that part of your elbow, it pinches, it kind of twinges on that ulnar nerve. So a lot of times you feel kind of zingers up through this side of your arm and maybe like your pinky and your ring finger part of your hand, because that's where that nerve normally brings information from. So when you normally touch, that part of your body, that's the nerve that it travels down. So if you're whacking your nerve right here, even though you're not touching anything down here, your brain's going to interpret that, hey, there's kind of zings and pains and tingles and stuff right here. It's just because we are activating the sensory information that's heading back to our spinal cord and eventually to our brain saying this nerve was stimulated, even though it actually wasn't. At the periphery where the receptors are, we kind of pinched it here in your elbow, and that's why the funny bone is the funny bone. All right, the last one here in our brachial plexus is the radial nerve. So that one kind of comes out here more towards the lateral side, the thumb side of your arm. It's not quite as long as the ulnar. The radial nerve innervates the extensor muscles of the arm and the forearm. So think triceps brachii and your extensors, like your extensor carpi radialis, extensor carpi ulnaris, and also your brachioradialis. So those are the muscles that it innervates. And then it brings in sensory information from skin over the posterolateral surface of the limb and the radial half of the hand. So if we again come down here and look at our hand picture, it's going to be mainly on that posterior, like middle of the hand towards the thumb, kind of what's highlighted purple here. So that is going to be your radial nerve. All right, we're not going to be, it's continuing down here. There we go. We're not going to go into the branches of some of these nerves, so we don't have to go to the lateral and superficial branches or the deep radial nerve. So if it's not on the list, you don't have to know it. All right, so those are the nerves of our brachial plexus. So I will stop here and we'll start another video with some of your chest and move on into the lumbar and sacral regions next.